Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Guidelines expanded for cervical cancer screening to include self-swab HPV test. The American Cancer Society, ACS, has expanded its guidelines for cervical cancer screening to include self-collection for human papillomavirus, HPV, testing. The new guidelines, published in CA, a cancer journal for clinicians, aim to improve access to cervical cancer screening, especially for underserved populations in rural areas. Key points. Clinician-collected cervical specimens are still preferred for primary HPV screening, but self-collected vaginal specimens are now acceptable for average-risk individuals aged 25 to 65 years. Repeat screening is recommended 3 years after a negative self-collected HPV test. The ACS has amended the guideline to recommend HPV testing at ages 60 and 65 years, with the last HPV test no younger than 65 years, in response to high rates of cervical cancer in those aged over 65. The ACS recommends discontinuing screening for average-risk women with a negative primary HPV test or negative co-testing at age 60 to 65 years. Self-collection options are seen as a critical resource for individuals in rural areas and other underserved populations who may have difficulty accessing healthcare. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. /speak